The UK government is seeking to reform the NHS with the new Health and Care Bill. This video talks through what changes this bill could bring and how the BMA plans to respond to it. Government's Health and Care Bill will deliver significant legal reform to the NHS. This is intended to deliver on many of the proposals and goals set out in NHS England's long-term plan, focusing on pursuing integration and collaboration over competition. However, the BMA has concerns about critical aspects of the bill, and we will be working hard on behalf of our members to ensure that it is amended and strengthened in order to protect the NHS from unnecessary private sector involvement and to establish a health and care system that is fit for the future. The bill aims to make significant change to existing NHS architecture. This will see the formal creation of ICSs, integrated care systems, as statutory bodies, which will bring health and care services across the NHS, local authorities and others together to plan, deliver and commission care. CCGs will be dissolved, with their duties, powers and resources absorbed into ICSs. Within ICSs, all health bodies will be bound by a duty to collaborate and be expected to pursue the triple aim of better care for patients, better health and well-being for all and sustainable use of NHS resources. The bill would also see the removal of Section 75 of the 2012 Health and Social Care Act, which requires commissioners to competitively tender for NHS contracts. The replacement system, called the provider selection regime, would instead give commissioners three options. The first, to renew contracts with existing providers without competitive tender. The second, to offer new or existing contracts to providers again without competitive tender. And the third, to launch a competitive tendering process for a contract where deemed appropriate. This is intended to avoid wasteful competition and provide greater stability, but safeguards and transparency are absolutely essential to ensure proper scrutiny of commissioning. Additionally, the bill is likely to increase the powers of the Health Secretary over the NHS. These could include the power to set or reset the direction of the NHS, amend or abolish arm's-length bodies, create new NHS trusts, intervene earlier and more proactively in disputes over service reconfiguration, as well as new powers over the collection and storage of data, and a duty to publish a report on roles and responsibilities regarding workforce planning every 5 years. Now we'll move on to how we want the bill to change and our key campaign priorities. The first of which is to strengthen government accountability for ensuring adequate numbers of staff in the NHS. While a proposed reporting system in the bill is welcome, we do not believe it will be sufficiently meaningful unless it also includes what must be delivered. In order to do this, the bill must include a responsibility for the Secretary of State to produce ongoing, accurate and transparent workforce assessments which directly inform the NHS's recruitment needs. We believe the bill must also go further regarding clinical leadership within ICSs. A truly collaborative and integrated healthcare system must have strong clinical leadership at its heart, with those with frontline expertise and knowledge of the NHS helping to shape its transformation. To this end, we want clinical leadership in primary care, secondary care and public health, as well as patient representation, to be embedded at every level of ICSs, at system, place and neighbourhood. This should include formal roles for local medical committees, local negotiating committees and public health doctors. The bill's proposals to replace mandatory competition need to be strengthened too. While removing present rules on competition is a positive step, without proper safeguards this still poses significant risks. As we have seen during the pandemic, unaccountable commissioning can feed the so-called democracy and see contracts simply handed to inappropriate and ineffective providers. This has to be avoided within the NHS. The NHS must be a publicly funded, publicly run service, so, to truly protect it from the unnecessary involvement of the private sector, we are arguing that the NHS must be made the default option for all NHS contracts. We are also concerned that the proposals within the bill regarding parliamentary responsibility for the NHS are focused more on securing political power over the health service than on ensuring accountability for its performance. As they stand, the proposals risk increasing political influence in NHS decision-making and undermining long-term planning should political imperatives change. To avoid this, we are calling for the introduction of clear safeguards and limits on the use of these powers. Finally, while we welcome efforts to improve data sharing across the NHS, we are concerned that the proposed new powers for the Secretary of State over data sharing could circumvent existing protections regarding the dissemination of patient data. We believe that safeguards over the reach and nature of these powers must also be included within the bill. These should include clarity on the extent of the powers and ensure that they do not undermine current protections over the use of patient data. The BMA has been actively lobbying policymakers, including the government, the Department for Health and Social Care, NHS England and parliamentarians on our key priorities for the bill. This has included direct meetings with ministers, consultation responses and parliamentary briefings. All of this work will continue and escalate as the bill progresses through Parliament to ensure that the BMA's voice and concerns are heard and that the bill is reformed in the best interest of doctors, patients and the health service.